my name is Dr. Foo, and I would like to talk today about fever in children. I think this topic is a common cause of anxiety among parents. So today I would like to discuss a few things. Is fever dangerous? Will your child have brain damage from fever? Are you as parents overreacting during fever? What are the signs, red flags that I should watch out for if my child is having fever? When do I take urgent action, or can I just continue to observe at home? What should you do when my child has fever? Alright, so let's get on to it. I would like to approach this question. Is fever dangerous? Yes, because fever may be due to something dangerous, and also no, because fever itself will not cause death. So it is very important for us to differentiate. Fever can be due to something dangerous, like a serious infection, such as dengue fever or a very severe influenza infection. So it can be something dangerous, but fever is merely a reaction to the severe, serious infection. It is a defense mechanism, but fever itself will not cause death. Now, what is fever? Some renowned institutions and also a lot of experts will define fever as 38 degrees Celsius above. However, in real life practice, I would say that anything above 37.5, we should be alert already that it can be the beginning of a fever. Anything between 37.5 to 38.5, it can be considered as low-grade fever, and above 38.5 is high-grade fever. Of course, in a significant fever, we should expect it to be above 38. Yeah. Now, if a child is very active, if a baby or a child is very active, not cranky, they're not fretful, but when you test the temperature, it is 37.7, 37.8. Do you need to urgently rush to give them a fever syrup? I do not think so. You have to take the whole thing into a big, consider the whole thing in a bigger picture, yeah, and watch out for dangerous signs and symptoms. So what can cause fever? Primarily, fever means infection. Okay, so infection is the most common cause for fever in children. So most fever are caused by infection, such as a throat infection, a ear infection, lung infection, which is known as pneumonia, the brain infection, which is known as meningoencephalitis, and also urine tract infection. Skin infections like cellulitis due to complication from a bad skin infection can also happen. Immunization, yeah, sometimes babies and kids, they can get a low-grade fever as a normal response after being vaccinated. Overdressing in infants, in babies also, especially the newborns, because they can be influenced quite easily by the external environment. So they may appear to have a fever due to overwrapping, or they are in a warm environment, like a room with no proper air conditioning, not enough ventilation, because babies do not regulate their body temperatures as well as the older kids and adults. So if you detect fever in a baby who are usually overdressed, especially if the temperature is not even above 38 but nearly 37.8, 37.9, it is better to just release the wrapping, cool down the environment, and repeat again. Yeah? Fever happens is because upon detecting microbes or a foreign object, right, your immune response will be activated. There will be inflammatory chemicals that is activated, and then it will cause the thermostat that is located in a special part of our brain, in our brain stem, that cause the thermostat to reset to a higher temperature, which is why sometimes if the infection causes your thermostat in your body to reset it to 39 degrees, if your body temperature is only 37, you will start to feel chill, you may have shivering to generate more heat, so much so for you to achieve to a body temperature of 39. Then only you will feel not cold, you feel normal, but actually you're already very hot all over. If I say a statement of, is a fever of 39.5, is it more dangerous than a fever of 38.5? So you have to bear in mind that fever is not just a numbers game, okay? It's not just a numbers game. We have to consider the overall picture of the child. It cannot say, oh, if it's above this much, it is very, very dangerous. If it's below this much, then you no need to worry. You have to take it, everything you have to take it with a pinch of salt. Yeah? For example, a baby that is less than 3 months old with a temperature of 38 above, especially a neonate or a newborn, you have to take it very seriously. But if a 3-year-old child or a 30-year-old man with a temperature of 38 but otherwise very well, you can still consider to choose to observe at home, provided that you're very confident of what to watch out for. A baby of 3 to 6 months old with a temperature of 39, is considered alarming. Those who are 6 months old above, sometimes the height of fever, whether it is 38 or 39, does not necessarily correlate with the severity of the illness. You have to consider the overall picture, whether the child is active, whether the child is still cheerful, is able to eat, is not mentally confused, is not too sleepy. Yeah? If your child is having a low-grade temperature, let's say 38.0, 38.1, but very, very lethargic, compared with a child who is having a temperature of 38.7 but running around happily, singing, you should be more concerned with the one who is very weak, even though the body temperature is actually less than the one who is appeared to be having a high-grade fever. So how do I determine whether my child is okay or not? I always ask parents to watch out whether can sleep, can play, can eat, can drink, no problems with breathing, no persistent vomiting, doesn't look very weak. I think that will be okay. But of course, always, if any doubt, bring to a doctor to check. It's important to get a proper assessment by the doctor so that the doctor can watch out to identify, to detect whether there are any dangerous signs that we can miss out if we miss out at home only without being checked by a doctor. So yeah, I think to get an assessment to rule out any sinister causes, for the doctor to identify any danger signs and symptoms is important, and not just to get a magic treatment. Yeah. So what can I do at home besides bringing to see the doctor? Yeah, like I said earlier, if it's any doubt, if you have no experience, you're not sure, always bring for a doctor to assess, to make sure that nothing is dangerous. Okay, and after that, at home, always give plenty of fluids. Very important to have a cooling environment and prevent dehydration. I do not advise you to switch off the air conditioning or switch off all the fan and make the room very stuffy and very warm. This can lead to overheating. Do not overwrap your child just because it's shivering. Yeah, if your child is shivering, that means the thermostat in the human body, in the brain, is still set at a very high bar because of the inflammation going on. To make the child feel more comfortable, you should give the paracetamol. Okay, medications, you make sure that you do not give too much. Yeah, paracetamol can be given every 4 to 6 hourly, hopefully not more than 4 times a day. Make sure that the dosage is correct according to the weight. You can sponge a bit, but use only lukewarm water. Do not use ice cold water because that will make the child even more uncomfortable and cry unnecessarily. And of course, make sure that the source of infection is treated, and that is why you should bring to see a doctor, because you want to identify the source of infection and treat it accordingly. So friends, ladies and gentlemen, I hope that my brief sharing today on fever helped to alleviate some of your anxiety around this topic of fever in children. I hope that it will it will serve as a good guide for you in your future management with your child when they encounter a febrile illness. Thank you very much.